Uh,
We're not gonna play musical.
all right. Uh, the right hand of the Father, then. There you go. Testing. Do we need this mic, or can you hear me? I guess we can use the mic since we set it up. Good morning and welcome to the 2021 Proclamation for Community Health Center Week. The agenda is as follows. I'll give a little bit of the history, then we'll have the proclamation signing, and then closing. Just to give everyone a little history, community health centers, and I'm going to read the full proclamation because I think the language is rich and the words are meaningful. But to really back home, as you've heard me say year after year after year, Teche Action Clinic has the distinction of being the first and oldest community health center in the state of Louisiana. We were founded in 1974, so we're celebrating 47 years of existence this year. And I think it's a testimony to those that came before us. As you remember, Teche Clinic was first funded under a 329 grant, which was a migrant grant that was initially intended for the sugarcane workers, the seasonal farm workers. And then we've expanded through the years. So if you fast forward now, which what began as a humble, pilot or experiment nationwide, is now turned into the largest primary care network in the nation. So the proclamation reads, for over 50 years, community health centers have provided high-quality, affordable, comprehensive primary and preventive health care in our nation's underserved communities, delivering value to and having a significant impact on America's healthcare system. Whereas the country's largest primary care network, community health centers are the healthcare home for 30 million Americans in over 14,000 communities across the nation. 1 in every 12 people in the United States gets their care in a community health center. Whereas community health centers are a critical element of the health system, serving both rural and urban communities, and often providing the only accessible and dependable source of primary care in their communities, nationwide community health centers serve 1 in every 5 residents of rural areas. Whereas community health centers serve as beacons of essential resources and support in testing and treatment in the face of the global coronavirus pandemic, and will continue to offer reliable, affordable, high-quality care against COVID-19 for America's most vulnerable and underserved communities. Whereas everyday community health centers develop new approaches to integrating a wide range of services beyond primary care, including oral health, vision, behavioral health, pharmacy services, to meet the needs and challenges of their communities. And whereas community health centers are governed by patient majority boards, ensuring the patients of each center are engaged in their healthcare decisions. And you can see behind me on the wall here are our board of directors. Whereas community health centers are locally owned and operated small businesses that serve as critical economic engines, helping to power local economies by generating $63.4 billion in economic activity in some of the country's most economically deprived communities. I'm proud to say that we have an operating budget over $25 million, employing over 250 people. So we certainly contribute to the economy of the community. Whereas community health centers nationally employ more than 253,000 people, including physicians, nurse practitioners, physician assistants, certified nurse midwives, dentists, pharmacists, and a whole array of healthcare providers. Community health centers model continues to prove effective in overcoming barriers to healthcare across healthcare access, including geography, income, and insurance status. Whereas the National Health Center Week offers the opportunity to celebrate America's 1,400 health center organizations with 12,000 delivery sites, their dedicated staff, board members, and patients, and those responsible for their continued success and growth. And therefore, and this is actually under the signature of the mayors and parish president Hannegriff. So August 15th through the 21st has been declared Community Health Center Week. And I can't thank each one of you enough. As you've heard me say repeatedly in the past, I have the greatest admiration for local elected officials. And I've run across some of you when we go to Washington and we go visit our United States senators, our congressmen, and obviously they play a huge role in what we need to get done for the state of Louisiana. But as I often remind them, the people that they serve can't put their hands on them like they can you. Everyone knows where each one of you live. They know where you worship. They know where you shop. They know how to find you and put their hands on you. So you can't get more local than what you all are. And I know each one of you are dedicated to the communities that you represent. And you've been great partners to work with us. I think this whole crisis just illustrated the partnership that we've had historically, and that we're all in this together. I saw something this morning where this graffiti artist went around and he made this one little thing where it was a boat and it said we're all in the same boat. And that's never been truer than today's times. So I like to say no one can help save us from us but us. And we stand united in St. Mary Parish for sure to make sure that we have the healthiest community that we can have. And Teche Clinic stands ready to continue to do the work that we do. So I'm going to put the mic down and stand behind you, gentlemen, as you all affix your pen to the proclamation sign. Each one has a signature page at the bottom with your names on it. So I'm going to come over that way. What I'd like to do is just open the floor to each of you. I'll start with President Hannegriff, if you want to say a few words.
Thank you, Dr. Wilkes. First of all, I want to thank yourself, of course, all your staff, and those individuals and agencies that provide service to you, that allow you to provide amazing service to the community, not only in St. Mary Parish, but across the state. To this day, Teche Action Clinic is still the gold standard community health center. And I can't say enough on the work you do, and I want to thank you for your continued service, sir.
Duval Arthur, City of Berwick. I'd just like to say thank you, Dr. Wilkes, and to your 250 employees and that board that we're looking at up on the wall. They continually, along with you and your staff, find ways to improve the health care of people living in our parish as well as the other parishes that y'all now serve. We can't say enough good things about you, so please keep up that great work that you do.
Thank you.
Mayor Abel Prejean, Dr. Wilkes, I want to congratulate you and your fine organization on 47 years of excellent service. And I want you to know that people of the town of Alwyn are very appreciative and much in need of your services. And so thank you again, and please keep up the good work.
Rodney Grogan, City of Patterson. Dr. Wilkes, our personal and professional relationship has basically, Patterson has benefited altogether. In this pandemic, anytime I called upon you for advice, we needed people to get vaccinated and so forth, you all were right there. And I do know probably about 40 to 50% of my population receive services from your program, and we're blessed with the health care that we're receiving. Thank you.
Good morning. First off, for over 50 years, Teche Action Clinic has been a beacon of light in the community. When I think about the inception of how it was started with the farmers my wife's grandfather, Reverend John Harris, was was the first president of Teche Action's board. So in the Katy Plantation and all of the people that utilize these services for Teche Action, this has been a beacon of light. We're very thankful from the city of Franklin as mayor. I'm overly excited of the continued efforts of Teche Action Clinic and the things that this clinic has done in this community and the services, all of the staff members and all of the people that have utilized this clinic, and has always been a great beacon of light in our community. So we thank God for Teche Action Clinic and the work that Dr. Wilson and his entire staff does for this community. So thank you and God bless.
Thank you, and I'd be remiss if I didn't recognize our staff. I want to particularly thank Florence and Milani for putting together the refreshments that you'll be enjoying, and that's our Chief Legal Officer back there, Beryl, and Carla Zaki, I'm sure you all know. I want to thank the media, Teche Talk, Howard with the Breeze, and Tiger for Augusta City, and Keki Kwei, who's always been here to get the word out. I would be remiss if I didn't, thank the patients who've been loyal and have been the reason that we're here. It's better to serve than to be served, and it's been a tremendous honor to serve them. I'm going to encourage everyone that can hear my voice and see my face to please, if you have not gotten vaccinated, to please get vaccinated. There's been 0 deaths from vaccinations, but we've lost 11,000 Louisiana citizens from COVID. And it is preventable. We have been given a gift. I mean, the Lord blessed us with the technology to develop 3 very, very effective vaccines. And shame on us if we don't take advantage of this opportunity. All you have to do is turn the TV on and look in countries like India and Africa and seeing people begging for the vaccine. They're dying in the streets, literally, all over the place. And here we have it available, and still we aren't taking it at the rate that we should. And for those that may get infected, God forbid, we do have another tool to help with monoclonal antibodies. That if that happens, you can contact your primary care provider, and we have sites set up throughout the parish that can now deliver those infusions, and soon we'll be giving it in a injection form. So I want to thank all of you again for coming, and be safe out there. I'd like to say stay positive and test negative. Thank you.